Are you struggling with chronic pain, anxiety, fatigue? As an osteopath, I've found a new tool that's making a real difference to my patient. And today I'm excited to share something that could potentially change your life. I mainly treat people with injuries, aches and pains, but many of my patients also deal with issues like high blood pressure, digestive problems, anxiety, headaches, chronic fatigue, and chronic pain. In treatments, I help my patients with their physical issues, mainly through stretching, massage, joint manipulations, and exercises. For some health issues though, nutrition, lifestyle changes, supplements, exercise, improving their sleep or digestion might also be needed. However, sometimes these issues don't always respond to these changes. Chronic issues like anxiety, headaches, long COVID, and chronic pain conditions like fibromyalgia can be difficult to treat with a hands-on approach. And that's where this device comes in. This is the Nurosym, and in this video I'm going to tell you what it is, what it does, and how it could potentially help you with your chronic conditions. Now, before I go too far into what this does, let me tell you, I was very skeptical when I first heard about this device. I'm like that with most things until I've done enough research into the scientific journals and have looked at as much evidence to support its benefits as possible. And only then will I give something like this a try. Now, when it comes to treating people, there can be certain patients, conditions, or challenges that a hands-on approach might not be appropriate for or has little effect on. For example, someone with true fibromyalgia may not be able to tolerate much touch, making it difficult for them to feel better. A common theme among patients with chronic health issues is an imbalance of the parasympathetic and sympathetic nervous system. The parasympathetic nervous system is responsible for your rest and digest functions, like increasing your digestive function, slowing your heart rate, and improving sleep quality. The sympathetic nervous system handles your fight and flight reactions, such as increasing heart rate, breathing rate, and blood pressure, while slowing down other functions like your digestive system. Now, one particular nerve responsible for many parasympathetic functions is the vagus nerve. It runs from your brain down through your neck, into your chest, and then into your abdomen, innervating multiple organs along the way. Dysfunction of the vagus nerve can lead to issues such as high blood pressure, anxiety, migraines, poor sleep, constipation, bloating, and acid reflux, and more. Now, this is where the Nurosym can help. So what is the Nurosym? The Nurosym is a certified medical neuromodulation device, which means it can affect your nervous system. It emits specifically designed electrical impulses to the brain through this clip here, which attaches to the tragus of the ear, affecting a branch of the vagus nerve called the auricular branch. It's designed to be easy to use. You simply clip the earpiece onto your tragus. If you wet the contacts, it will give you better conductivity. You power it on, you select your treatment duration, the intensity, and you're good to go. And it's by stimulating this branch of the vagus nerve that we are able to stimulate the vagus nerve and help boost function of the parasympathetic nervous system. Now, this all sounds quite complex, but essentially what we're doing here is boosting the function of a specific division of your nervous system that will in turn boost some of your bodily functions that may have previously been less efficient. Now, this time you might be thinking that this device is a gadget or a bit of a gimmick and just something that biohackers would probably use. But vagus nerve stimulation has been around for many years, originally through complex and invasive implantation of devices into the neck. But now devices like these are able to stimulate the vagus nerve through non-invasive methods. The Nurosym has over 60 university partnerships, including Harvard and UCLA, as well as 30 published, peer-reviewed, independently funded clinical trials and thousands of participants. It is the most studied neuromodulation system of its kind at the moment. After having looked at many of these studies, I was interested enough to try it myself and with my patients. So how have I been using this in my practice? Well, I've had a handful of patients that I've been able to use this with so far. Here are some of their stories. My first patient is a female in her early 30s who has had seizures and chronic pain for many years. Her seizures could be as often as every day in some weeks, and this often meant she would have seizures while at work, at the gym, or at home. She noticed an improvement in sleep and a slight reduction in chronic pain after 2 weeks, which doesn't sound like much, but this meant she didn't feel so exhausted after any of her seizures. My second patient was a male in his early 50s with chronic neck pain. He reported an improvement in sleep after only a few days, but little change to his neck pain within a week. In this case, we were not expecting much change in the neck pain due to structural changes within the vertebrae themselves. Another patient of mine in her early 30s had recently had glandular fever, or mono if you're in the US, and was struggling with her energy on a daily basis, finding it difficult to get to the end of the day without feeling exhausted. She noticed an improvement in sleep, a reduction of anxiety, and a reduction in the frequency of headaches after only 1 week of using this. I will continue to use this device on patients who I think could benefit, and perhaps in a future video, I will be able to report more outcomes for a larger group of patients. I get my patients to use this 1 to 2 times per day for a total time of 1 hour. So that could be 30 minutes in the morning and 30 minutes in the evening, or it could just be one session of 1 hour. The key to success with this device is consistency. Use it daily, similar to how regular workouts at a gym build muscle over time. Similarly, you are more likely to see results using the Nurosym if you are consistent with using it over a period of time. The recommended time frame to use the Nurosym is at least 30 days, but it could take longer. So how do you use this device? Well, it's so simple. As you can see, the device is very minimal. It's designed to be easy to use and as simple to understand as possible, so anyone should be able to use it. It consists of 2 pieces, the device itself and an earpiece which simply pushes into the device. There is a charging cable and a felt pouch that everything fits into. The device itself has only 4 buttons. The power button here at the bottom, the plus and the minus buttons, and the enter button. To use the device, simply clip the earpiece onto your tragus. It can help to wet the contacts and your ear first to ensure good conductivity. Then press the power button until the device boots up and select your treatment duration using the plus and minus buttons up to 60 minutes. Then press the select button. Now you need to set your desired intensity. Use the plus button to increase the power until you can feel a pleasant tingling in your tragus where the earpiece is clipped. For me, it usually sits around the 23 mark. Once you've used yours several times, you'll get a good idea of what number you can start at. This shouldn't be uncomfortable or painful, and taking it to the point of pain or discomfort will not mean you get better results. Once you have your desired intensity, just click the select button and that's it. If during your treatment you feel like the intensity is too high, you can quickly reduce it by simply double pressing the minus button. Or if you feel the intensity is not enough, you can easily change it by pressing any button to wake the device up, then push the enter button twice, which unlocks the device, and then you can increase or decrease the intensity, and then press the select button. If you need to pause the treatment at any time, you can also press the power button to pause it and press it again to resume. A great time to use this would be before bed to help put you in a more relaxed state, ready to go to sleep. Now, it goes without saying that this device is not a magic device and it won't fix your problems on its own if you're not prepared to make changes elsewhere. It's an aid and not a cure. Now, what I mean by this is that if you get yourself one of these devices, you will need to take the opportunity to also make changes to your lifestyle, your nutrition, your routine, and work on your stresses wherever possible. Gradual improvements in all areas over time will have a profound impact on your body's ability to heal and help you recover from whatever issues you're facing right now. If you would like to learn more about the Nurosym and how it could help you, or you would like to buy one, then head over to their website. Nurosym offers a 30-day guarantee. So if for any reason you don't like it or you don't see any results, you can easily return the device back. Now, I've left a link in the description below, or if you're watching this on a big screen, you can simply scan this QR code just here using your phone. Both of these links will get you a discount if you decide to make a purchase. Now, just to be totally transparent with you, I will make a small commission at no extra cost to you. But of course, I am recommending this device because I think it works, not because of any commissions that I might make. The vagus nerve is such an important nerve, and if we can ensure it functions well, then we have a much greater chance of being healthy. And there are ways that you can stimulate your vagus nerve if you don't have access to this device. And this video will guide you through some of those ways of stimulating your vagus nerve. So go and watch this video now.